Yeah. Yeah, actually, one more thing I wanted to ask you, Dr. Ahmed. So
Yeah,
probably from when you'll be starting your FRCS Part 3 course?
I will start it like the next Monday.
Next Monday. Okay.
Yeah,
It will live classes.
it will be live classes. Then they will be recorded.
Uh,
So it will be like 2 sessions per week, and we will discuss this. We will come to this
uh,
now
uh,
after we just give this orientation. So just stay to the end. Don't go away, and we will
no, no,
say
no.
everything. Okay.
Yeah, yeah, sure, sure. Oh, okay. Hope so. Hope so. I'll try to be awake. It is already here 10:30 now in India. Yeah, I'll try to be awake as
I
much as
will
possible.
not be that long. I promise you, I will not take that much time because I already have a session for those
Uh,
speaking in Arabic. So hopefully,
uh,
I always say that I will not take so long, but
yeah, it'll go.
sometimes
I remember those ICO
I
classes
can't
going up to
help.
2.
Yeah.
Yeah, yeah. I remember those ICO classes going up to 2 in the morning for me, actually.
You know that there are some classes that last for five hours. So
Yeah,
maybe Sarah knows that also. Like we stay
yeah.
for 5 hours. Okay. So
Uh,
I think that you can you see the screen now? You see the presentation?
yes, we can see that.
Okay. Hopefully the doctors will join us soon because I don't want to be late. Can you see me in the screen? Like my video?
Yes, Dr. Ahmed.
Okay. So hello everyone and welcome again to this new orientation session, and it gives me pleasure when we have some new updates that we would like to share with you that makes your life easier with exams. So here is one of those big days where we have very good news to share with you in order to make your pathway with the FRCS much easier and much more rapid. So today's session will be about the recent updates regarding the FRCS Glasgow, and today's session will be, as you know, we tend always to classify our lectures and our sessions into specific topics. So for the first topic, it will be about orientation about the FRCS Glasgow. So we always tend to orient those who have no idea about the thing till those who have great information about the topic, but they will need just to the recent updates or relevant information for their exam. So we will try to cover the things from basic to advanced, and we'll move to the next session where we are going to discuss the FRCS updates and the what is the study books and what are the study tips, and I will tell you what is my opinion about the different study books that you should consider for this exams. And finally, we will discuss the relevant information about the FRCS courses. So starting about the orientation, so most of us know that the FRCS exams is divided into 3 exams. It is the first part, which is the basic sciences and optics exam, then the second part, which is the clinical written exam, and the third part, which is oral and the clinical exam. So this will be like where you are facing patients, you are examining real patients, and you are asked questions from the examiner in like face to face, like a face to face exam. So these are the parts of the exam. The format of the exam itself, like the part one is an MCQ exam. The part two is an MCQ exam, which is one of the most recent changes that it was a written exam. It divided into an MCQ exam and a paper called a problem solving paper. However, it is now an MCQ exam only. And the third part, which is the oral and the clinical exam. Okay, so what is the structure of each one? Like the part one is an MSQ exam consisting of 160 questions. These questions are a single best answer, and they are only in 2 hours, which is one of the huge drawbacks of this exam. It has a very limited time. The part two MSQ exams is 180 questions that is divided, that is in the format of single best answer, and also it is very limited in time. It is only 2 hours and a half. The oral and the clinical exam, it is basically oral exam, which is consisting of 3 stations. Each station is for 20 minutes. And also clinical exam, which is 4 stations. Each station is 12 minutes. In the oral or in the clinical exam, in each station, you are asked by 2 examiners. So one examiner will ask you questions, and the other examiner will record your answer, and he will record your result. And this will be in the half time of the station. And in the second half, they will switch. So the other one will ask you, and the first one will record your answers, and you will record your results. Okay. So let's get more in depth in details of these exams. So part one will be consisting, or the curriculum of part one will be asked in the anatomy, embryology, physiology, pathology, pharmacology, cell biology, microbiology, genetics, and optics. While in the part two, the MCQ part two will be asking, you will be asked in the clinical history, investigations, ophthalmic medicine, ophthalmic surgery, ophthalmic pathology, medicine, neurology related to ophthalmology, and also medical emergencies. Bear that in mind. In part three, as you know, it will be divided, you will be examined over 2 days, one for the oral and one for the clinical. So the oral is called the Vive, and the clinical is called the OSCE. So in the oral, you will be examined in 3 stations. Each station will take around 20 minutes. The first station will be, you will be asked in diseases of the anterior segment and oculoplastics. The second station will be diseases of posterior segment, and third station will be asked in the neuro ophthalmology, motility, and general medicine. Regarding the clinical day, you will be asked in 4 stations. Each station you will be asked mostly in 2 or 3 patients maximum. So the first station will be on the anterior segment. Second station will be the posterior segment, and third station the oculoplastics, and fourth station will be the neuro ophthalmology and ocular motility. Regarding the eligibility, so what are the criteria that will make you eligible for a certain exam? Starting from the part one, you will be eligible if you have a primary medical qualification that is accepted by the WHO for medical licensing. So if you have MBBS or MBBCH, or most of the medical qualifications of our regular colleges are accepted for this exam. And not only the qualification, but also the years of experience, because you should have 1 year of experience after internship. So as it is stated in the Royal College website, it says that you should have 2 years of experience after qualification, 1 year of which is the pre-registration year, or what sometimes in some countries it's called internship, other countries it's called like the house officer year. So it is just the training year that you have immediately after the graduation. So if you have 1 year of experience, it is just 1 year, not 1 years. So after the internship, and you already have postgraduate, you have your primary medical qualification, then you are eligible to apply for part one. Then you need to the apply to part two. In order to apply for part two, you should also have a primary medical qualification, and you should also apply have passed the part one FRCS Glasgow, or already or have any equivalent qualification. Those equivalent qualifications are the ICO Basic and Optics, and which is called now the ICO Visual Sciences and Optics, or you could have Part A FRCS Edinburgh. And those who are asking, but the FRCS Edinburgh is cancelled now. Yes, I know that it was cancelled like the 2 or 3 years, but still the Royal College of Surgeons of Glasgow recognize it. So if you have it earlier, like before 2018, or if you are going to apply for it in 2022, when it will be reinstated again, it is still will be accepted by the Royal College of Surgeons of Glasgow. Also, if you have Part 1 FRC of London, then it will be also recognized in order to apply for Part 2 the FRCS Glasgow. So this is regarding the qualifications. Regarding the experience, you should have 4.5 years of experience in ophthalmology after internship. So according to the Royal College of Surgeons of Glasgow website, they say that you should have 6 years of experience total after the qualification, of which 1 year should be an internship, and of which 4.5 years should be in ophthalmology posts. So 4.5 years of ophthalmology experience should be present at the time of application, not at the time of the exam. Okay. So what happens if you pass the part two, then you are eligible to apply for part three. So part three eligibility criteria are to have the MBBS or MBBCH and passing the part one or equivalent and part two or equivalent. So what is the equivalent of part one? As we mentioned, it will be the ICO Basic and Optics, part A FRCS Edinburgh, part one FRC of London. So what is the equivalent of part two? It will be the clinical ICO. So if you have clinical ICO, or if you pass the FRCS Glasgow part two, the MSQ exam, you are eligible for part three. And at that time, no further experience is required. So you can apply for part two, and as soon as 6 months or the next diet immediately, you will be able, or you are eligible to apply for part three. Okay. If anything is unclear, just let me know. So here is I want your undivided attention, because here I'm going to make a comparison between the ICO and the FRCS Glasgow Part 1 and the ICO Clinical and the FRCS Glasgow Part 2, because I received many questions asking me about which one should we admit, or which one should we apply for, because both exams can make you reach the same destination. So is it better to apply for the ICO Basic Sciences and Optics or the Visual Sciences and Optics, or is it better to apply for the FRCS Glasgow Part 1? And likewise, is it better to apply for ICO Clinical, or is it better to apply for the FRCS Glasgow 2, which is the new exam? So let's make this comparison. First of all, what is the number of questions in the ICO? It will be the total of the ICO Visual Sciences and the Optics will be 180 questions, while the FRCS Glasgow Part 1 is only 160 questions. So does this make the odds in favor of FRCS Glasgow Part 1? That's what will we see now. Here is the first shock, which is the format. The ICO, it is a single best answer of 4 options, while the FRCS Glasgow Part 1, it is a single best answer of 5 options, which makes it more difficult. And not only that, but here is the big problem, which is the duration. The ICO, if you apply for it or you take the Visual Sciences and the Optics on the same day, it will be like 3 hours for the Visual Sciences and 1.5 hours for the Optics, a total of 4.5 hours for 180 questions. On the other hand, the FRCS Glasgow is less than 50% of the duration. It is only 2 hours for 160 questions, which is extremely limited time for this exam, with this level of difficulty. Speaking about the level of difficulty, what is the difference in difficulty between the ICO and the FRCS Glasgow Part 1? The ICO can be considered easier in the ICO compared to the FRCS Glasgow Part 1. There are more direct questions in the ICO. The ICO questions are a little bit unreasonable, meaning that when you are solving the ICO exam, most probably you will find questions from another world. Like you don't have any idea where did these questions came from. You haven't ever encountered them in any practice MCQ books or any online MCQ bank. They are just from the imagination of those who are putting the ICO exams. So you will find that there are some questions that unreasonably difficult, or these questions are not very well formatted because this is unreasonable questions. On the other hand, the FRCS Glasgow are, it is more or less reasonable, meaning that if you already studied well, if you have practiced a lot of MCQ banks, a lot of MCQ books, you will find the questions appear from what you studied. So nothing weird, nothing off the books, but you need to study very well because the question itself are difficult. So unless you have deep understanding of the basic sciences and optics, you will be unlikely to score well in this exam. The diets also is a great or a striking feature and a striking difference between the ICO and the FRCS Glasgow Part 1, because in the ICO, it will be, you can divide them into two diets, one for visual sciences and the other for optics. However, in the FRCS Glasgow Part 1, it is only single diet for both, which is like any other fellowship exam. It is only divided in the ICO. The fees also can be a little bit different. So the ICO can be a little bit expensive. I try to make them in sterling pounds in order to have an idea how much is the difference. So the ICO visual sciences and optics roughly will be around 500 sterling pound, while the FRCS Glasgow Part 1, it is a little bit cheaper. So it will be 350 sterling pound. Special advantages about the ICO is the previous papers, like the previous Q banks for the ICO, where you can practice solving a lot of hundreds of MCQs that appeared in the previous exams. So with a lot of repetition, this will increase your chance of passing the ICO. That's why I am telling you that the difficulty here is not that much compared to the FRCS Glasgow Part 1. The special advantage about the FRCS Glasgow Part 1 is if you have if you are frightened from optics, if optics like is a huge problem for you, then rest assured that the optics is only 25% of the FRCS Glasgow Part 1. So it will be like minimal amount of optics questions, and for the full explanation of the quota for each topic in the exam, please refer to my lecture, Road to UK Ophthalmology Exams. You will find each topic of the exam will have how much percentage from the whole exam. Okay, so this is between the ICO and the FRCS Glasgow Part 1. Regarding the difference between the ICO and the FRCS Glasgow Part 2, well, we will go through the main parameters that we should compare between them. Like in the ICO, the clinical ICO is 200 questions, while the new FRCS Glasgow 2, it is 180 questions only. However, the ICO, it is a single best answer of 4 options. The new FRCS Glasgow 2, it is a single best answer of 5 options. Here is again the striking difference between the ICO and the FRCS Glasgow Part 2. The ICO, you will solve 200 questions in 4 hours, while in the new FRCS Glasgow Part 2, it is 180 questions in 2.5 hours, which is a great difference, making again the FRCS Glasgow 2 difficult in terms of the time constraints. Well, it is very limited in time, so you should be quick. You should be studying very, very well in order to not to think too much in the questions. So this again will make the ICO less difficult than the FRCS Glasgow Part 2. But again, weird questions unlogic questions, unreasonable questions are more frequent with the ICO exams. Like you find scenarios with a lot of debates where you have to go for surgery or for medical treatment or for just observation. You will find a lot of debates regarding the ICO clinical questions. However, those the questions in the FRCS Glasgow Part 2, it is more difficult, requires more study, but it is reasonable. If you are studying well, you will score well. Here is another striking difference between the ICO and the FRCS Glasgow Part 2. That's emergency medicine. There is no emergency medicine in the ICO. While in the FRCS Glasgow Part 2, it will be there is emergency medicine questions, which is again will add to the difficulty of this exam. And by emergency medicine, we mean emergency medicine, not ophthalmic emergencies, like internal medicine. So this should be also considered. The fees between the ICO and the FRCS Glasgow Part 2, it is more or less the same. There is no much difference between both of them in terms of fees. And the special advantages about the ICO exam is the Q banks also. So we have like around more than 1,500 questions from the ICO past papers. So this is a huge Q bank, and there are a lot of repetition in the exams. However, to be honest with you, the repetition is not like the previous years. The repetitions is now becoming more and more less after 2019. While the major advantage of the new FRCS Glasgow, that it will qualify you for a new qualification, a brand new qualification called the Mrcs Glasgow. In order to obtain the Mrcs Glasgow, you should only pass the FRCS Glasgow Part 2, which is the new exam, or you already passed the FRCS 2, the older exam with the two components, both the clinical MCQ and the problem solving. So these are the only criteria and the only conditions that you makes you eligible for the FRCS Glasgow, Mrcs Glasgow. However, the common question that I frequently being asked, which is if you have clinical ICO, are you eligible for the Mrcs Glasgow? The answer is no, you are not. Okay. Regarding the mode of delivery, so since that we are now living in the era of COVID-19, the exams are just in the format of online format. So whether you are applying for part 1 or part 2 or part 3, so part 1 and part 2 will be MCQ exams, and you will be able to set it online. And also the part 3 will be made online, either the oral component or the clinical component, which will be in the forms of videos that you will be comment. So the clinical component have become more or less like the oral component. We will come to this in a few minutes. The fees, so the part 1 fees is around 350 sterling pound. Part 2 and part 3 are not announced yet on the website. However, roughly they are the part 2 550 sterling pound. Part 3 will be 1,200 sterling pound, which this is like this is just an estimate of the fees. However, this will make the FRCS Glasgow the cheapest. It will be the cheapest fellowship exam up till now. The Royal College of Ophthalmologists of London is more expensive because it consists of 4 exams. The Royal College of Surgeons of Edinburgh, although it consists of 3 exams, however, it is still being more expensive. Thank you, Dr. Zhao. So Dr. Zhao says that it will be 1,425. It is becoming more expensive, or 1,435. So this will also make this exam a little bit more expensive, but it is still cheapest between the different exams. Okay. So I just put one 1200, because this is like when I did the exam, it was 1100 or 1150. So it is every day exams become more expensive. So location, again, it is all online. However, for part three, I'm expecting that many of you may not be able to apply for the part three while it is online. So if like the next year it is becoming more on site, I will tell you just it is made on like 7 different locations in Oman, in Jordan, in UK, in India, in Malta, and recently it will be conducted in Egypt. Okay, so but for the current time, for the date of this video, like as we are speaking, I will the video is in August 2021. So all these information are valid till that date. Regarding the number of diets, so part one is conducted in March and October, part two in March and October, part three, 7 diets. So it will be distributed along the year. And I expect that there will be diet in November and December. So this is how it was before the COVID-19. There was diet in November and December. So those candidates who apply for these diets are allocated between Oman and Muscat and Malta in these 2 months. So be ready if you are willing to apply for this exam. You should start studying, because you may think or you may consider that you will apply in November and December. Okay, so this is the first section of our lecture, which is an orientation regarding the FRCS updates. What are the recent updates regarding the FRCS2 and the FRCS3? In the FRCS2, the most striking update that the problem-solving exam is cancelled. There will be no problem-solving exam starting from October 2021. This exam was like a major obstacle for many of the candidates. Many of the candidates were struggling for this exam for years. They have no clue how to pass it, how to solve it. And here is the good news that no longer, I consider this is like the golden era for the FRCS. Those who wanted to apply for the FRCS, it is now or never. This is these recent changes had made the FRCS pathway much more easy and much more feasible. So try to do the best in order to catch these changes or catch these updates before they will re-update it. And also the important update was that a new qualification is coming to the surface, which is called Mrcs of the Ophthalmology Glasgow. So we have been familiar with the Mrcs Edinburgh. However, there is now new Mrcs Glasgow, which you can have after part two. So this is the new qualification. It's called Mrcs Ophthalmology of Glasgow. So if you are asking me what is the value of this Mrcs Glasgow, it will be the same value of the Mrcs Edinburgh. There are some countries that may recognize it for a license, like in Egypt, for example, and they will recognize Mrcs for license to practice. But you need to ask, or you need to inquire in your country if the Mrcs will be valuable for your practice or not. However, in the UK itself, it will not enable you to have GMC registration and license to practice, because actually it is a written exam. There is no oral or clinical component. So just in case you are wondering if you can apply with GMC registration with MRCS, the answer is no. So how can you obtain the MRCS? It will be either you pass the new FRCS2 exam, which will be conducted from the March 2022. You will, after passing this exam, you will be automatically eligible for the MRCS Glasgow. Or if you have passed the older exam, the problem-solving exam of the Royal College of Surgeons of Glasgow, you will be automatically, you can apply for the membership and you will be able to obtain it. So basically, how to obtain the MRCS Glasgow? If you have part 1 or exemption. So if you can have basic sciences or optics, or FRC of the part 1, or FRCS Edinburgh part 1, or have a part 1 FRCS Glasgow, then you have the part 2 MCQ and the problem solving or exemption before June 2021. Like if you have clinical ICO and the problem solving before June 2021, then you will be able to apply for the Mrcs Glasgow. However, if you after June 2021, the only acceptable qualification for the Mrcs Glasgow will be the new Part 2 MCQ exam of the FRCS Glasgow. So clinical ICO doesn't count here. Okay, this is for the FRCS, this is for the Mrcs Glasgow. What about the FRCS3 updates? For the part 1, or the first update is the clinical ICO alone will qualify for the FRCS3 exam. As I told you, if you have a ICO clinical exam with the ICO visual sciences and optics, then you are able to apply for the FRCS3 straight away if you have the required clinical experience. The second thing is starting from the year 2021, the FRCS3 will be conducted online. So we have only a single diet which was which was conducted online like the previous month, and the result appeared the few days ago. And let me tell you, this was one of the most great results of the FRCS exam. Like the online exam showed to be very in favor of the candidates. It will eliminate the stress of the face-to-face exam. So candidates tend to perform better in online assessment rather than a real test. Not to mention you are saving the costs
Doctor,
of travel.
please, doctor.
Yeah.
The slideshow is not changing.
And regarding the FRCS3 updates, it will be now the clinical ICO alone will qualify for the FRCS3 exam. It will be conducted online starting from this year, as I told you, it will show it showed to be a very good result. The pass rate is more higher than the real exam. And the clinical video assessment. So this is like the way how those of the FRCS try to overcome the issue of clinical examination. So basically, instead of doing clinical examination of a real patient, you are asked to do clinical video assessment, where you are asked to do confrontation test and asked to do cranial nerves examination from the first cranial nerve to the eighth cranial nerve, just to have a video of yourself and then send them this video so that they will evaluate your technique. So this will be much more easier than the real test, where you are asked to do full examination for the cover and the motility, the ptosis, the proptosis. So it is now very, very easy to pass this exam. Okay, so what is the fourth update? That they will eventually need international expansion. Like they will need those. There are a lot of candidates who are now wants to apply for the FRCS3, and since that they are making it online, this will make them have more capacity to accommodate more candidates. And so this will be for online, and even after the end of online era, they will need to increase their exam centers around the world. So actually, the FRCS Glasgow is now considered the highest number of centers among all Royal College surgeons exams. However, they will increase it more. And what we have confirmed news that it will be a center in Egypt. So this will be very good news, not only for candidates from Egypt, but also for candidates from other countries where they are considering giving this exam in real. So Egypt will be like a lot cheaper than going to the UK, no visa, and and it will be much easier for them to apply than to go to the UK, for example. So it will be the same like going to the India. Just hold on, please. So what will be the study resources? What will be my recommended study resources and my tips for this exam? So let me give you or tell you what are the commonest resources. So the first one is the case reviews in ophthalmology by Neil Friedman. This was the book that I used to study for my FRCS exam many years ago. And this was like the first edition, and there is now a second edition. So there is a second edition now. So it was not saved. But anyway, the second edition have more cases and have more illustrations. So this will be the book for a beginner, because the level of discussion in this book is to a basic level. Like if you have no information, you have studied very long time ago, and you need some book to refresh your knowledge, to make you a good start for your study, then this will be the book for you. However, I am stressing that its level of questions is not that hard, and you may face more difficult questions in the exam. The second book is the Ophthalmology Examination Review by Wong. Again, this was the standard book for the FRCS exams. When I had my exam, it wasn't the third edition, it was the second edition, which was very outdated. Now a new edition have been available in the last few years, which is the third edition. And if you are going to study from this book, you must study the third edition, because there are a huge difference between the second and the third edition. Okay, so this is the value of this book, that it will orient you about how are the oral discussions are going to be, how are you going to approach clinical patients. So it will just summarize the clinical examination, the approach for clinical patient in just steps, in stepwise manner. So this will be like to make like a mind map for your brain, how to approach a patient. And also it will cover a huge amount of topics. So this will be like a comprehensive review of ophthalmology. This is not like just for exam, but it will cover extra topics that may not be very common in the exams, but this book is just trying to cover everything. So you cannot hear my voice? Can you hear my voice?
Yes, we can hear.
Yes, we can.
Okay. So this book will be very good for you if you want a comprehensive resource for studying, that will cover everything. But this is for any clinical and oral exam. This is not particular for the FRCS. So this is important to mention. Like if you have time, if you have plenty of time and you want to study everything, then this will be the book for you. However, the main what are the disadvantages of this book? That it doesn't have dedicated investigations part to cover the investigations. It doesn't discuss the clinical examination techniques. So it is mainly focused, in my opinion, it is mainly for the oral exams rather than for clinical exams. So the main drawback for this book is that it is lacking photos. So if you are being asked in an oral exam, you will be most probably have photos. So this was fixed in their next book. So this book is Practical Guide to Vive and OSCE in Ophthalmology. It is again by Wong. He is the same guy who made the first book. The difference between those two books is that this book has photos. So they will bring you a photo, and then just it will just like a copy paste from this book. It will just give you the photos and then copy and paste the same questions and answers from the ophthalmology examination review. So nothing new. These two books can be considered like a one book. So you may consider studying from this practical guide if you want a comprehensive resource for ophthalmology for oral and clinical exams. However, the only like disadvantage of this practical guide is how it is formatted. Like in order to save space in this book and in order to accommodate for these photos, the questions and the answers are made in the format of paragraphs and not in the form of points as in the older book, in the ophthalmology examination review. And for many of us, the paragraph pattern is just difficult to memorize, difficult to remember. It is not friendly for those who have visual memory. So you should consider this if you are considering this book, that that the ophthalmology examination review is better for studying. However, the practical guide to Vive and OSCE in ophthalmology is better for photos, just for photos.
May I interrupt you, please?
Yeah, sure.
Yeah, does this mean that the book in the middle, the ophthalmology examinations review, is the best one to pick from these three books? Or does it mean we have to, or we could study from both of them, practical guide and the ophthalmology examination reviews?
Just wait for me, but because I still didn't finish the books. So when I finish the books, I will tell you how can we choose the good book, okay?
Okay, sorry for interruption.
No problem. So what is the fourth book? The fourth book is the Ophthalmology Review, a case study approach. Those who attended with me the problem solving course, I told them that this will be the best book to recommend for the FRCS problem solving, because this book will give you a practical approach for each case, and this will be very suitable for writing type of questions, for essay type of questions. It will discuss the questions in holistic approach, discuss everything about the questions. So is this the best for the final part or the Vive and OSCE? Absolutely no. Why we recommend it for the FRCS problem solving and we don't recommend it for the FRCS Glasgow Part 3? Because simply, in simple words, you don't have enough time to discuss everything in this book. This book requires a lot of study. It is extensive. And in the real exam, you will not be allowed to have like a long conversation with the examiner in order to discuss everything in a topic. Like you will, if you see this book, you will find a topic is discussed in like 3 pages. You are unlikely to discuss 3 pages in front of the examiner. The questions are the FRCS type of questions is limited by time. So they will only ask questions that have specific answers and they are expecting specific points. So you are not, this is unlike the FRCS problem solving. You are where you are just discussing the way you are thinking for the exam, for the question or for the problem. So you have more space to write and more space to elaborate your thoughts. Okay, so the only value for this book is a differential diagnosis. So if you are struggling with differential diagnosis, if you have problems, when you are asking about any lesion and you are just to remember 1 or 2 differentials, then you can have a look at this book. But again, I don't recommend it. It is good, of course, but it will be very time consuming. The 5th book, which is the Vive and OSCE exams in ophthalmology. This is a relatively new book. It was issued in last year in 2020. And this book is also giving you an approach for patients in the Vive and OSCE. And I would recommend it for those applying for the FRC of London. Like those who are applying for the FRC of London, this book is made specifically for them. like because it will show the relevant studies published by the Royal College of Ophthalmologists of London, like the diabetic retinopathy studies. It will also it will give you a clue about or it will discuss in great deal the communication skills and the concept of general of good medical practice as announced by the GMC, and would also discuss many things that you will need for passing the FRC of London specifically. However, there are some certain parts in it which is very good for the FRCS Glasgow, like I admire the part of investigations. So if you want a concise chapter or concise illustration of investigations in ophthalmology, you will find that in this book. Other than this, for my recommendation, my number one recommendation is the FRCS Ophthalmology by Cakewalk. So FRCS Ophthalmology Cakewalk is a book written specifically for the FRCS exam. It is among all books, the only book will show detailed step-by-step clinical examination. So it will give you how to examine a pupil, how to examine confrontation test, how to examine a case of ptosis, in the way that it is required for the FRCS. Not only that, but it will also provide you with oral discussions like questions and answers of how the common questions in the FRCS exam, and also it will bring you some unanswered questions of real past questions from the previous candidates. So it will give you like a clue how to think or how to approach a case. So let's say, for example, if you are facing a case of optic disc edema, or if the examiner asks you to check for optic disc edema, then you will find an optic disc edema and then ask you to check motility. Most probably, if you don't have this FRCS mindset, you will not know what are you expecting to find in a motility exam of a patient with optic disc edema. But if you read this book, or you are now FRCS oriented, you most probably will think that optic disc edema can occur in multiple sclerosis, or of course it is not that common, but if a patient, for example, have optic disc pallor, also it could be due to multiple sclerosis. So if you are doing a motility, what are you expecting? You will expect to find, for example, internuclear ophthalmoplegia. So having known these simple facts will make you more relaxed in the exam, that you know what you expect in the exam. And this is the whole idea about the FRCS. Like, I will tell you something, that FRCS exam is a very, very predictable exam. It is not like rocket science. You can still like you will have, or I made like this list of topics that I use it to give to my candidates, that will have more than 90% of the topics that can be asked in the FRCS exam. It will be like only have a margin of error of 10%. So actually you have most of the exam. You will be able to predict most of the case of the exam, even certain diseases, certain topics, they tend to appear frequently year after year in this exam. So based on the question that you are asking, that which one that we should choose, if you have number one book, it will be the FRCS Ophthalmology by Cakewalk. And if you are, this will be, if it is still difficult for you, if you find yourself, no, you still need to read at a basic level, then you can choose the book of the Neil Friedman, which is like a very basic book. And this will be together with, if you have time, then you should study the Wong book. So again, if you have average time, then if you want only single book, if you want just one book, then it will be the FRCS by Cakewalk. If you want, if you have still plenty of time and you want to prepare thoroughly for any surprises in the exam, then you should start by FRCS Cakewalk and the Wong book. And the Wong book, we mean the Wong with images. So it will be the enhancement of the original Wong book. If you find yourself struggling with these books, you didn't study from long time ago, then you should start the preparation early and start by case reviews in ophthalmology. Okay, the only things that you can take from the ophthalmology review case study approach is the differential diagnosis, and what you can take from the Vive and OSCE exams in ophthalmology is the investigations, because you are asking in investigations as well in the exam. And the remaining you will study it from the FRCS Ophthalmology by Kekok. Okay, you got it now? Is it clear? Okay, so the last part is the study resources. So of study resources is the emergency medicine. You can study the emergency medicine from the Oxford Handbook of Emergency Medicine, or by some notes of the emergency medicine, which is summarizing the Oxford Handbook, which is the emergency medicine by Dr. Walid Badr. And this will be like more than enough for the exam. It will be like 90 or 100 pages that will show the common medical emergencies that you will encounter in the exam. And let me just tell you about something about the medical emergency. You will be asked in the medical emergency by internist, not ophthalmologist. And this is like good news, not a bad news, because the good news about that an internist will expect that you don't know much information about the medical emergencies, so the questions tend to be more superficial. So, and also it tended to be more ophthalmology related, like ask you about the atrial fibrillation, because what is the relevance of atrial fibrillation to ophthalmology? What are the diseases that it may cause in ophthalmology? And this like if you have a patient who had fluorescein angiography and he was collapsed after a fluorescein injection, so what do you think of, and how would you manage? So the questions tend to be more relevant to ophthalmology. This doesn't mean that you will not be answered in any non-ophthalmology questions. This you can still be asked in pulmonary embolism and in shock and in burn and in toxicity. However, you can still pass if you didn't answer one or more of these questions. Like this is not like the deal breaker for this station. So don't panic from the emergency medicine. You can study it, and this station tend to be more forgiving. Okay, so let me give you my top 10 tips for this FRCS exam. Well, what is the golden rule? The sooner the better. The patient is facing you, the magic words, the FRCS style of thinking. Speaking is gold, no answer, no problem. Avoid the trap, be flexible, and have a mentor. So what is the golden rule? The golden rule is to be a fellow, you have to follow. This means that when you are applying for an exam, such as a FRCS or any other exam, you have to follow the advices and of the previous candidates. You have to follow their rules. You have to follow their study resources. This will make you don't fall in the same mistakes that they fell in. So please just try not to reinvent the whole process. Just try to follow as you learn the surgery. By when you are doing this, like learning a surgery, you are like a robot. You are just imitating the whole steps. You don't think. You don't try to make something new. Unless like after 100 surgeries or 200 surgeries, you may try a new technique. But in the beginning, as long as you are still learning, or you are still new to this thing, just you are trying to follow the advices and to follow the rules that are set by the previous candidates, and not only by the rules but also follow the previous candidates' experience. So try to check for the previous candidates' experience, see what are the kind of cases that they were examined in, and what are the questions that the examiner are asking. Let me tell you something, that in this exam, the candidates tend to memorize the examiners by their look and by their nationality and by certain features. They are stereotyping the examiners. So you may find the one in someone saying in the past experience, I had a question from an examiner with long white beard, and he is wearing like that. So you see how much that the candidates, the previous candidates, are giving full detailed instructions and full detailed experience. So these experience are very, very valuable. The second thing, I think that you know that it is the sooner the better. The sooner that you start the preparation, the better. The sooner that you will try to do the clinical examination techniques, try to have like case discussions, as I'm going to tell you. And it is not only case discussions, but it should be supervised case discussions. So here is the trick about this exam. We all know that practice makes perfect. But for this exam, it is the supervised practice which makes perfect, because practice without supervision, it is like you are doing the same mistakes. So try to, as soon as possible, to do the clinical examination techniques, to study the cases that you see in the clinic. The more you study and with discussion, the more chance that you have to pass this exam. Because so let me just give you an example. If you are, since that we are now living in the era of Olympics in Japan, so just imagine yourself that you are an athlete and you are going to the Olympics in Japan, and you are practicing the sport just the night before the contest. Do you expect that you will win the silver or the gold or the bronze medal? Of course not, because it takes time. It takes time to build your physical fitness, and also it takes time to build your medical fitness, and it takes time to build your surgical fitness. Good things take time. So don't just wait for the last minute to start preparation. Don't wait until you register for the exam to start preparation. Just start now. Start now, please, because you will understand the value of these times when you face the exam, because you will encounter many cases. So study these cases, study them with the FRCS style in mind, and this will give you great chance for passing the exam. The third tip is that the patient is facing you. So by the patient is facing you, meaning that don't try to just give theoretical answers. Like for example, if the examiner give you a picture of an OCT with macular hole, and it is a full thickness macular hole, it is a stage 4 macular hole, and he asks you about the management, don't say, I will observe in stage 1, and then I will observe in stage 2, I will do whatever in stage 3. He is not asking you the theoretical question, just asking about a patient is in front of you, a patient that he has this picture of macular hole stage 4. So be specific, be targeting only the question that is asked in the exam. Okay, don't just give the examiner a question from a textbook or an answer from textbook. Then the tip number 4, which is the magic words. We said that in the problem solving, and we are repeating it now. What are the magic words in this exam? First of all, describe. So when you have an exam, you should describe the lesion. When you are seeing a picture, or you are facing a clinical case, you should describe. Why you should describe? Because first of all, if you just mention a differential diagnosis, if you just mention a spot diagnosis, and it turned out to be wrong, you will lose this station. Like if you see a patient with microaneurysms or hard exudates and said, this is a diabetic retinopathy. Okay, the examiner may told you, but this patient is not diabetic. And this happened with one of my colleagues, and he failed the exam. because you didn't describe. You have to describe what you are seeing. You have to describe the signs. Like it is hard exudates. These are soft or large, soft or hard. They are small or large. They are in the macula, outside the macula. They are associated with CNV or not. There are dot and blot hemorrhage. So here is you are describing, so you are giving yourself a break to think of a differential diagnosis. So and also you are gaining marks. The more you describe well, the more you are gaining marks. So these are the main two values of description. You are gaining marks and you are opening the question for differential diagnosis, so that the examiner will know that you have a broad mind. You are thinking horizontally or you are thinking laterally, as we will see now. So, and also for clinical, the same goes for the clinical. If you see a patient with third nerve palsy, you know the third nerve palsy, but you don't say a patient, this patient, you see a patient with ptosis and the eye is down and out. So you say that it is a third nerve palsy. No, this is wrong. Don't say that. But what we say, there is an apparent ptosis of the left eye. This is complete or incomplete ptosis, and the eye is deviated down and out, and most probably that this patient has a third nerve palsy. So this will be the correct way for answering the question. Okay. The second magic word is counseling. Like if you have a patient, and one of the common questions in the exam, that how to do a PRP. Most of the candidates say, I will do PRP, I will adjust the parameters, and I will adjust the shot size and the time interval and so on. So they jump into the technique. However, there is a huge step, or there is a very important step that you missed, which is counseling. How will you counsel this patient? Like this patient could, after the procedure, reports that he has night vision problem, but you didn't tell him that. This patient could have an important question in his mind: is this procedure is painful or not? But you didn't address that. So you should address the patient concerns pre-operative or before the procedure, and in the procedure, and after the procedure. So this will be like the same, like the process of consent. How will you consent to the patient? So don't forget the counsel, because it will also give a good impression about your answer. The third magic word is referral. And as I mentioned that before, that you should refer your patient to other specialties. We are not working in isolation from other specialties, but whenever there is a need to refer a patient, like for those patients who will receive steroids, they will need steroid workup. They should be referred to internist for measuring their blood pressure, their blood sugar, their bone density, to check for the presence of peptic ulcer, presence of tuberculosis. So don't forget that for whenever a patient needs referral, you should do so. So the FRCS style of thinking, also the tip number 5, the FRCS is training you to have a specific way of thinking, which is to think of the most serious and the most common. Like in the exam, you have to know what is the most serious and the most common for each differential diagnosis. And if you don't, like they can, if you miss anything in between, or if you forget something in between, they may forgive you, but they won't forgive you if you missed the most serious or the most common. Also, think of the related and associated lesions. So this also means that you have broad mind. You are thinking laterally, of thinking like if the patient has optic neuritis, multiple sclerosis optic neuritis, and you know that multiple sclerosis optic neuritis, it can be associated with intermediate uveitis. So you will check the pars plana for the presence of intermediate uveitis. Now you are not only focused on the optic nerve, but you're also thinking of other related signs related to the same disease. And also think of double pathology. Like for example, in my exam, I had a patient. I was asked to examine a patient in the slit lamp. I found that the patient had patch of iris atrophy, and he had pseudophakic or he had pseudophakic IOL, or he was pseudophakic. So I was asked, what do you think of this patient? Why this patient? Well, I said that this patient had a patch of iris atrophy. So he asked me, what do you think? What could be the reason? I said it could be trauma. It could be from the phaco probe during the cataract surgery. It could be from the herpes. Okay, herpes can cause iris atrophy. So he told me to check for the fundus, and when I checked the fundus, I found there is a commercial retinine, and I found also a patient. I found also a macular hole. So he told me, what do you think now is the reason for these pathologies that this patient have? I think that you all know that it is clear it is a trauma. So the FRCS style of thinking is to build a scenario that will connect the whole pieces of puzzle together. So when you see the patient, you will know what is the history, what did this patient had, by just collecting the signs and putting them together. So always think of a double pathology. Whenever you have a single pathology, always check for the others. Don't jump to a diagnosis based on single pathology. And also avoid eccentric thinking, like common is common, and what's common in the real life is common in the exam. So just don't think of like rare diseases before considering the most common and the most serious, as I told you. There is a famous word saying that if speaking is silver, then listening is gold. This is a Turkish proverb. So is this true for the FRCS? No. Actually, in the FRCS, speaking is gold. And what do we mean by speaking is gold? In the FRCS, when we had the FRCS exam with real patients, one of the major concerns of the examiner is that he don't want his patient to get tired. So he wanted the examination to be as quick as possible. And that's why they ask you to speak as you examine. And this is a skill that you need to master early before the exam, because if you didn't do this, you will be struggling to do this in the exam. So whenever you are examining the patient, you are saying, I find in the cornea has lesion number 1, lesion 2, lesion 3, in the iris, lesion 1, 2, 3. The examiner will not wait for you until you finish the whole examination, and then you will tell the signs. Of course, now it is becoming much more easier since that you are not examining a real patient in the online, but just in case, if you had an examine a real patient, you should remember that you should speak as you examine. So you may ask yourself, but what if I have no problem and have no answer? Like if the examiner is asking me a question, but I don't know. So do I just say anything? I try to improvise and try to fabricate an answer. This will be the huge mistake or the most huge mistake that you may ever do. If the examiner asks you a question and you don't know, simply say I don't know, or I don't remember, or I don't recall, and the examiner can do any of the following options. He may give you a clue to make you know the answer, or to make it easier for you, or if he realizes that this question is difficult, as if you are at the end of the station, he may jump to another question and tell you this is not important, and will ask you another question. Or he may invite you to ask him about anything, about history, about a specific sign or symptom that will enable you to reach a diagnosis. So knowing or not knowing an answer is not the end of the world. Even if you don't know the answer, it is still you can still pass this exam, or you can still pass this station, because the evaluation of your performance in this exam is not dependent on a single question, unless the question is fatal, like if you missed a very serious side effects or a serious complication or something that will endanger the patient's life or the patient vision, a single question or not knowing a single question will not make you fail the exam. Okay, so again, refer to the rule number 3 or 4 that you have to know the most serious and the most common for each case, and the examiner will forgive you in between. If you don't know the answer, just to say that you don't know, and it will, and then ask for differential diagnosis. This is like, or sorry, ask for more information. If you just or if you have in the exam, if you don't know something, then the one way to overcome this lack of knowledge is to ask the examiner. And many of us don't know that they have the right to ask the examiner. So ask the examiner for more clues, ask for history, ask if the patient is male or female, ask if the patient is young or old, ask if the disease is acute or chronic. Also ask like if you have a patient with any lesion, try to elaborate by just describing what you see, describing the lesions present in the photo, or describing the clinical findings in the patients in the clinical exam, and then ask the examiner more clues. Okay, if the examiner thinks that your question is irrelevant and it will not lead you to diagnosis, he will tell you that this question is irrelevant. So just don't the examiner is trying to help you. This is what I want to tell you. So the examiner is trying to make it easy for you to reach the diagnosis. The next thing is avoid the trap. My next step is to avoid the trap. What is this trap? Is that if you have a curse of knowledge, like if you are a consultant in a certain specialty, like if you are a veterinary consultant or a strabismus consultant, and you have very in-depth information in a certain specialty, and you are asked in this specialty in particular, you will be happy because this will be your area, this will be your game, and you will try to discuss as much as possible of all recent updates regarding this topic, and the papers published in this topic and what you heard in conferences about this topic. However, this is not what is needed in this exam. The exam at the level of a general ophthalmologist. So don't go in depth of subspecialized information for many reasons. First of all, the examiner himself may not know this information, because actually when you are asked in strabismus, it is not a strabismologist who is asking you. So if you are a strabismologist, you may mention a procedure that is not known by the examiner, and this will not make you in a good position. The second thing is that when we are speaking about surgeries in particular, for like if you are a retinal surgeon and the examiner asking you about a specific surgery, and you do these surgeries multiple times, you know all the tips and tricks about it, but and when the examiner is asking you how would you do the surgery, you are happy because you are a veterinary surgeon, so you are mentioning all details regarding the surgeries. However, the examiner will ask you in depth if you are saying that I will do the surgeries, because if you are doing a surgery, you are expected to know everything about the surgery. You are expected to be a safe doctor and not to make mistakes. So he will not forgive you if you do mistakes. However, what happens if you say to the examiner, well, I will refer the patient to a veterinary surgeon? So the examiner will ask you, okay, what will you expect that he will do? You will say he will do number 1, 2, 3, 4, and you are mentioning the steps. So this is a huge difference between two answers. In the first answer, you are not allowed to make mistakes because you are the surgeon. And the second answer, you are describing the procedure from the side view. So you can make mistakes because you are not a veterinary surgeon, even if you are a veterinary surgeon, and these mistakes will be forgiven. Okay. The next step is to be flexible. And what is meant by being flexible? Let's say, for example, that you are in the exam and the examiner asks you about something and you said an answer and it is a wrong answer. So the examiner may ask you, would you like to think of another differential diagnosis? In this case, don't insist in your answer or don't insist on your answer. The examiner is trying to guide you, not to mislead you. So whenever the examiner tells you that think of another thing, just go with him. Just go with the flow. It will make you reach your destination. But don't just insist on your answer. Don't be stubborn. This will make you lose marks. Like in my exam, for example, when I examined a patient who had some sort of corneal dystrophy, he asked me, what do you think that this corneal dystrophy might be? I told him, well, I think that it is a Rice buccal dystrophy. He told me, what is the level of Rice buccal? I told him it is Bowman's. And so he told me, okay, but could it be stromal? I said, yes, it could be. And he told me, what if it is a stromal, what could it be? I said, it will be, could be anterior stromal, it could be granular. He told me, yes, it is granular. So you see that he guided me to reach the correct answer. And so don't insist on your wrong answer. It will make you lose marks. Finally, the final tip is to have a mentor. Like, as I mentioned in the problem solving, that if you are not having a mentor that will supervise you, you are most probably will do many mistakes that you are not recognizing that these are mistakes. So it is a supervised performance is what will make you make your performance improve. This is in the medicine and the surgery. So like if you are not you can't drive a car by reading a manual. You also cannot be an ophthalmologist by just reading text. You need to practice, and you need someone who can tutor you, someone who you can trust, and who can guide you. This mentor can be anyone, like can be your colleague, your supervisor in training, your head of department, your senior resident if you are a resident. It can be a course, can be whatever, but it should be a mentor. You should have a mentor that will guide you, because this will ensure you the best and the most rapid and most correct way of improving your performance. And of course, as I always tell, that the easiest way to fail is to study alone. So also being a part of a group will a study group will also encourage you to study. If you don't belong to a group, you most probably will be overwhelmed by your daily tasks and by responsibilities in your hospital or at your home, and you will just postpone your study. So it will be also being a part of a group will motivate you to study. Regarding the final part of our session, which is the FRCS3 course, before those who, I think that most of you already attended my courses before. So for those who didn't attend my courses, let me just give you a brief about us. So we have been in the ophthalmic teaching for more than 10 years now. Last 6 or 7 years of which are on the field of the postgraduate medical qualification, specifically the FRCS and the FRC Opt. We have been fortunate to tutor more than 2,000 candidates from more than 70 countries around the world, and giving them or tutoring them for many courses, ranging from the ICO basic sciences and optics, clinical ICO, advanced ICO, FRCS, oral and clinical, and others. And through this period, we have given more than 1,000 lectures. So the course that we are introducing now is the FRCS3 course. So basically, we are not giving or we're not discussing too much details about FRCS1 because you can find more information about the course and the orientation and study material in the YouTube lectures. But this will be mainly targeting the FRCS3 course. So the top 10 highlights: the course will be conducted over 60 hours. It will be 60 hours, so it will be two lectures weekly. So each lecture will be like 2.5 hours to 3 hours maximum. I hope that I will not be increasing more than 3 hours per lecture. And these will be conducted over 20 live interactive sessions. So this is the virtue of this course. Like, this is the value of this course, that it is the interaction, that you will attend sessions where we are going to discuss and simulate the real exam experience. So one of the major problems for the candidates applying for the FRCS, that they are getting very stressed in the exam because they have never been exposed to such experience. They have never been asked in a way for the FRCS. So they tended to be confused. They tended to have unorganized answer, unorganized thoughts. So what we are going to do in this course is to just overcome this stress experience, to offer you a stress-free experience. So in this course, just try to speak up your mind, do as many mistakes as you can, because this is how will you learn, and this is how will you overcome the stress of the exam itself. Okay, so I have been doing this for the past 4 years now. So the first FRCS 3 course I've given in the 2016, and I found a huge difference between those who attended the live sessions, those who are interacting in the live sessions, and those who just listen to the record of the live session and didn't practice saying the exam in front of an examiner, or saying the answer in front of an examiner. There is a huge difference in their performance in the real test. Like, let me tell you something. I have been able to predict who will pass the exam. So based on their performance in the course, I can tell who will do well in the exam and who will just borderline, and who will not be able to pass because he is just not serious enough about his preparation. So if you just missed a live class, then we made the records available at our dedicated iCourses mobile application. So I want to limit this as much as possible, because I always encourage my students to attend the live classes. This will make them benefit from the best experience, and will also make them study in the pace of the course, so they will not accumulate the study over themselves. The course is bilingual, so we are introducing both Arabic and English classes. So for those who need, who understand better with Arabic language, for Arabic students, they can still apply for the Arabic classes. And also we will provide the clinical examination and investigations notes. So we will give you a detailed step-by-step notes of how to examine a case in the FRCS style, and also how to comment on fluorescein angiography in the OCT, in also the FRCS style. Also, you will be added to the dedicated WhatsApp group, and you will be added to a Facebook group where we share clinical examination videos, tips, cases, and all others in this Facebook group. So we tend to do that in the WhatsApp group, but we are now we want now to update. So we are adopting a new Facebook group, so that those who will join late will be able to see the previous conversations and the previous posts, unlike the WhatsApp group. So there will be certificate of attendance, and I believe that the real certificate will be your FRCS, but we also will give you certificate of attendance just in case if you need it for your CV. And there is also a huge advantage that we will offer for a limited time, that we will offer free access after FRCS exam registration. Like, for those who are registered in the course, we have a lot of already registered in the problem solving, and they will be shifted automatically to the FRCS 3. Or if you are just will still need to register, we know that you may not be accepted for the FRCS diet at that time. So in this year, or in the beginning of the second year. So what we are going to do is something unparalleled, something new, something no any other course offer, which we are going to offer you a free access for the records of the whole course if you just provide us with email confirmation of the FRCS exam. And this will be a limited, very limited time offer, and this will be like a 1 week offer for the next week only. So for those who are registered with us, they will enjoy this offer. And for those who will register with us from now for 1 week, they will also enjoy this offer. So you are now can combine both attendance of live classes, and you will also be able to attend, watch the records and revise before the exam whenever you apply for it. Okay. So what is the course curriculum? The course is divided into two main sections: the clinical examination, which will cover the neuro ophthalmology, in which we will discuss the pupil, the confrontation test, the nystagmus, and the cranial nerves examination. And by the way, this is already available on YouTube. So this is like, I will tell you something that the previous exam where they were asked to provide, clinical videos for confrontation test and the cranial nerves examination from 1 to 8. I believe that like all the attendees or all the candidates depended on my videos, which is present on the YouTube for this particular station, for this particular video. So you can go to the YouTube, search for iCourses, search for Neuro Ophthalmology examination techniques, and you will find it. It was recorded in 2016. So you may find that the voice is not very good because it was recorded on another platform, but it will not be the same for this course. It will be the same like as you hear now. Also, we will teach you the Strabismus clinical examination techniques, also the way the FRCS require it, like the uncover, the motility exam, and how to do duction, how to do pursuit movement, how to do saccadic movement, how to test for convergence. Also, the oculoplastic clinical techniques, like how to examine a case of ptosis, case of proptosis, case of enucleated socket. The anterior segment clinical examination techniques, like the slit lamp. So you may ask yourself, well, I'm not a resident to teach me the slit lamp. Well, you will be surprised to know there are a lot of data and a lot of information about slit lamp that you don't know and can be asked in the exam. So you need to master the slit lamp examination techniques and to know what are the different kinds of lenses and what are the auxiliary lenses that you can attach, auxiliary devices that you can attach to the slit lamp. So this will be also covered at that lecture. Posterior segment examination techniques, like how to examine with the 90 diopter lens, how to use the indirect and the indirect ophthalmoscope. This will also be covered in this separate course. So clinical examination, we made it like a separate course. So for those, because I know how much it is valuable for anyone, not only for those who are applying for the FRCS, but for any ophthalmologist. Like if you do clinical examination well, you will find signs. If you don't do it well, you can't find signs. So this will be like a separate course for those who need it. However, the full course will include the clinical examination and the case-based discussion. And in the case-based discussion, it will also follow up the same pattern and the same order of the clinical examination techniques. So there will be workup and the case-based discussion for each section of the exam for neuro ophthalmology, for strabismus and pediatric ophthalmology, for oculoplastics, for anterior segmentation, which will cover the glaucoma, the cornea, the lens, the uveitis, and posterior segment cases, workup and cases, and emergency medicine workup and cases. So there will be 2 lectures to cover the emergency medicine, and this also is not offered by any other course. So how would you like to, if you want to register, just contact us. You can contact our support team at WhatsApp, or at Facebook. You can contact us at our messages at the Facebook iCourses, or you can send us an email so that the support team will answer your queries. The course itself will start next Monday, so it will be just 3 or 4 days from now, and it will be on Mondays and Thursdays. So Mondays and Thursdays for the English group, it will be at 5 p.m. at 4 p.m. GMT, while the Arabic group will be at 7 p.m. GMT. So starting from the next Monday, we are very serious about your preparation, so we don't waste time. Just to start from the next week for 10 weeks, because I'm expecting that there will be a session or an FRCS session in the November and December. So it will be like you will have only 1 month or 2 weeks to 2 weeks to 1 month to prepare for the exam. So this is the time. We don't need to waste much more time. Okay, so that's it for today. This is the orientation session and the all information that we would like to share with you for the FRCS exam. Thank you, and I wish you the best of luck in your pathway to pursue the FRCS Glasgow. I hope that this lecture will shed some light on your pathway, make it more easy. Try to be eye opener for you to think of important tips and tricks to tackle this exam, and I will be happy to receive your questions. So please, if you have any question, just write in the chat box or unmute yourself and speak in the mic.
Thank you, Dr. Ahmed, and thanks a lot for your nice presentation regarding this FRCS. My question is that one, is there any limited attempts for this FRCS part 3, or there's no any limitation for that one?
Okay, let me tell you something, that there is a rule by the JMC itself that for any exam it should be limited to six attempts, 6 or 7 attempts. I think it is, to be on the safe side, it is 6. Okay, so this is not a rule by the Royal College itself. It is just a rule by the GMC. Okay, and speaking by, let me just give you important information also. I thank you for this question. Speaking about if I need to repeat the exam, what are the, is it easy to fail this exam? You may think if I failed one station, I will fail the whole exam. The answer, no, it is not strict like that. Meaning that in each station, each clinical or oral station, you are examined by 2 examiners. And okay, let me write that. So for each station, let's say, for example, for the anterior segment, you are examined by examiner A and examiner B. So each one of them give you a mark. This mark could be clear pass. If your performance is very good, you didn't had any mistake or didn't have any mistakes, or pass if you just made some simple mistakes that, but you didn't fail to recognize any serious problem, or you didn't fail to recognize a common condition, a common disease. Like if they present you a clinically significant macular edema, you can say that it is a clinically significant macular edema. It is a very common. Or you can have fail if you just made serious mistakes, or clear fail, like you are very unsafe, or you don't know very basic information. So what is the, how will you, or what is the possibility for you to fail this exam? If you have clear fail at more than 1 examiner, not 1 station, but more than 1 examiner. If you have clear fail at 1 examiner, you can still pass. If more than 1 examiner give you clear fail, then you will fail the exam. Or if you have fail at more than 3 examiners. So you see, you can still fail a whole station, like posterior segment station. You can have fail at both examiners, and you can still pass the exam. So the passing scheme or the marking scheme is not that strict. Okay, And as you know, once if you fail, you not repeat the same station, but you repeat the whole exam. And also you have two sections, like you have clinical and you have oral. If you have low marks in the oral, it can be compensated by the clinical, but not the reverse. The clinical is not compensated by the oral, but the oral is compensated by the clinical. Okay, so I just wanted to share you this information so that you understand how this exam is marked. Okay, I have Dr. Rifati. Sir, any time period for the course, I mean, what if I am unable to attend the exam at this time? I am able to carry over the course material for the next exam, or do I need to register? Dr. Rifati, I think that you joined us late because we said that we have a special offer for very limited time for the next week, that if you register within this week, because we only need the serious candidates. So if you are serious enough with your preparation, then we are serious also for your success. So we will offer you free registration. You will, if you, when you reapply for the exam or for one time, when you receive confirmation, like the next year, the second year, after 10 years, we will grant you free access to the course materials, all for free, so that you can revise. So no need for registration. Will the next lecture be on Monday? Will be Neuro Ophthalmology? Yes, I like to start with the Neuro Ophthalmology because first of all, it is the most important for the exam now, because they ask specifically about clinical examination of the visual field and the cranial nerves examination. So this will be the most relevant and the most important for the exam, and also because they tend to be difficult for many candidates. So I try to elaborate it more, and also you can find the lecture. You find the lecture on the YouTube, so you can prepare for it actually. So you have still some time to check for it, to revise it before we meet in the next Monday. So when we just cover the clinical examination techniques, then the next lecture will be to the case-based discussion and the workup, and so on. So start by the neuro ophthalmology, then pediatric ophthalmology, then anterior segment, posterior segment, oculoplastics, and so on. Okay, any other question?
Dr. Rahman, what do you suggest that we should go for part 3 after ICU clinical, or have to appear in the FRCS, this MCQ question?
I didn't understand.
I mean, if anybody who passed this ICU clinical,
Mhm.
should he go for FRCS part 3?
Yes, of course. Don't think of, if you have clinical ICO, don't think of the Mrcs Glasgow. Don't think of it. It is just a waste of time and waste of effort, because it will not be an easy exam, and it will not just it will not give you any advantage, like unless that I told you the only certain condition, if your country has a specific, give the Mrcs a specific privilege, like if it is recognized for medical licensing, then this will be the only way that you will go for the Mrcs. Unless that, don't think of it, just go to from clinical to the FRCS3 directly.
Thanks a lot, Dr. Aman, for your really have a nice time and give us information about this.
Thank you. So just in the YouTube, search for iCourses. You will find our channel, and you will find the YouTube lecture. If you still can't find it, just send a message to our support team, and they will send you the link. Any limited number of candidates, and any suggestions on or checking the 2 videos we will have to submit to Royal College of Surgeons of Glasgow during the course? Well, I will reconsider this. I will reconsider that. Actually, the criteria are available already in the Royal College of Surgeons in the email. However, I will reconsider to recheck your videos for clinical examinations before submission. And regarding the limitation on the number of candidates, Well, the previous diet, it was limited to 25 candidate, but I believe that they will increase this number. It will not be 25 because these 25 were postponed over the last 2 years. So that's why it was limited to them. But since now they are shifting to online, there will be more capacity to accommodate more candidates. Actually, the limited number was because of two reasons. The examiners themselves have energy, like they cannot examine the candidates for like 4 or 5 days or for 1 week, so they will just examine the candidates for 1 or 2 days, and also because they have limited number of patients, so they don't have endless number of patients, so that they can take many candidates. And this will change now. They can bring you whatever image, whatever clinical video, so there are a lot of varieties now, and they can examine you from the comfort of their homes. So they don't have any problem. So I expect that they will increase the number of candidates. Yes, this lecture will be recorded, and it's already recorded, and it will be available, and it will be present also on the YouTube. I take FRCS3 after October ICO clinical. Does taking this course now helps me for the clinical science also? Of course, yes. So in the clinical science, there are a lot of questions based on clinical scenarios. So they give you clinical scenarios where they would give you history, symptoms, and signs for the patient. And this is basically what we are going to discuss in this course. So we are discussing the history, clinical examinations, investigations, the treatment, and this is the core of any clinical science, any clinical exam, like clinical ICO, FRCS Glasgow Part 2, but it will be just training on the Part 3 in particular, but it will be very helpful for any clinical exam. Does this... Okay, Dr. Radwa, can we delay the meeting to 5 p.m. for English speakers and 8 p.m. for Arabic time? Well, Dr. Radwa, this was the standard. You know that this was the standard for Arabic for the course, for the problem-solving course. However, I received many requests to make it earlier because for those in the eastern part of the world, they have the course is very late at that time. And also, what makes me make it earlier 1 hour, because we will have more longer sessions than the problem solving course. So those longer sessions will require more time, and we don't want to finish at 3 a.m. So we will just move it a little bit earlier 1 hour. You are welcome, Dr. Zhao. Any other question? Okay, so I guess that this will conclude our session. Thank you very much for your attention and for attending this session.
And thank you very much for your effort.
I hope you all the best, and I will see you soon in the course, inshallah. Thank you and good night.